Hey guys, Felix from Evolt here. Now, June is Men's Health Month, and here at Evolt, we're talking all things men's health. Now, we've got a treat for you guys today. Not only is our guest speaker a nationally recognized expert in obesity, metabolic health, and digital medicine, he holds a triple board certification in obesity medicine, internal medicine, and clinical informatics. What's more, he has a master's degree in applied physiology. Please welcome Dr. Adonis Saremi.
I'm doing well. Thanks so much. Thanks for having me.
Now, Doctor, can you speak to your expertise and qualifications and why that gives you a unique perspective on human performance, weight loss, and metabolic health?
Yeah, absolutely. So I'm a physician, board certified in internal medicine, clinical informatics, as well as obesity medicine. And so my current practice consists of a lot of metabolic health, weight management, and longevity medicine.
Amazing. And Dr. Sarami, how do you define a healthy body in a clinical practice, and why is body composition a more meaningful metric than, say, BMI or weight, especially for men?
Yeah, so BMI can be a helpful tool, but to your point, it doesn't tell us the whole picture. BMI is measured by taking your weight in kilograms divided by your height in meters squared. And so you can have an individual who's very athletic and highly muscular with a high BMI, and at the same time, someone who has a very high fat mass composition who has a similar BMI. And of course, the individual with high fat mass has higher cardiometabolic risk. And so when you consider the entire metabolic picture, you want to look at things like body composition. What does a body consist of? What is the fat mass percentage? What is the lean mass percentage? Muscle, your organs. How much water is your body made of? How much of your body consists of things like bone. So these are all important components of metabolic health. We also look at things beyond that, such as waist circumference, consider ethnicity. These all give us a more holistic picture of one's cardiometabolic risk.
And I guess that leads into my next question is what role does skeletal muscle mass play in long-term health and disease prevention, especially for us men as we get older? And why is that so crucial?
Absolutely. So when we think about muscle mass, one thing to consider as we age is our muscle mass declines. Also with weight management, especially not only with diet, but these highly effective anti-obesity medications, you could lose muscle mass. When you lose muscle mass, that could lead to a condition called sarcopenia. Sarcopenia has its own inherent risk in terms of things like frailty, falls, and mortality actually in general. So when we lose weight through traditional means like diet, around 20% of that weight loss is due to loss of muscle mass, 80% is due to loss of fat mass. When you're taking highly effective anti-obesity medications, or even after bariatric surgery, you could have 30 to 40% loss of muscle mass. So it's very important to kind of monitor that. Again, we don't want to just look at the BMI. We want to look at muscle mass and body fat percentage, and really encourage high amounts of protein intake, typically around, 1.5 grams per kilogram of body weight per day, in addition to resistance training to maintain it.
And doctor, in your experience, how aware are men of the importance of preserving lean muscle mass during weight loss, and what are some of the risks they face if they don't prioritize that?
Yeah, I think having a combination of not only cardiovascular exercise, but resistance training. Resistance training is that type of exercise to really help build muscle. When you lift weights at the gym, that's a perfect example, or doing squats, for example, as opposed to more like cardiovascular exercise, like, running, for example, or perhaps swimming, where you're really getting that heart rate up and breaking a sweat. Both of these are important. So in general, during the recommendations are around 150 minutes of moderate intensity exercise, cardiovascular exercise a week, in addition to resistance training about, on most days of the week, I would say at least, maybe 3 to 4 days a week would be recommended. And to your point, men who are, trying to build muscle, as well as lose weight, that's a responsible way of doing it. You don't want to lose fat mass in addition to muscle mass. Ideally, you want to preserve that muscle mass and you want to lose that fat mass to optimize your body composition.
And what do you think are some of the shifts in mindset men need to make to prioritize muscle maintenance and long-term health rather than just focusing on a number that's shown on the scale?
Yeah, absolutely. I think it comes down to setting, personal goals, not necessarily focusing on the numbers. For example, I have a patient who indicated that one of his biggest goals is one, to enjoy time with his son and actually, bike ride in particular, and be able to kind of have the energy and endurance and mobility to do that. And today, he can't, but that's his goal. So it's less about, I want to lose this amount of weight. It's more about, I want to live more healthy and I want to be able to do the activities that I enjoy doing, especially with my family. So that's a perfect example, I think, of setting goals that meet your personal needs, not kind of focusing on specific, weight loss metrics that perhaps aren't as motivating and aren't really meeting your personal goals and needs.
And speaking on that, how can tools like the Evolt 360 bridge the gap between clinical care and preventative health by giving men more insight into their own bodies?
I think, Evolt is a great example of a clinical tool that could really give you insights into what your body composition is in order to provide a more personalized treatment plan, whether that's, just focusing on your diet and exercise, going to the gym and building muscle mass. If you're on a weight loss journey, you're using medications and working with a doctor, these metrics, again, go beyond just body mass index. It's more than just weight. It's about what, percentage of your body is made up of fat, what percentage is made up of muscle and lean mass, and how to best optimize that and measure it over time to stay engaged and motivated.
And Doc, do you ever see a future where tracking data like segmental muscle mass, visceral fat, or BMI becomes a standard in men's health checkups?
Absolutely. I think it's a super important part. I think there's perhaps a lack of education, even in the medical community about this. And, I really encourage patients and individuals in general to research this stuff and talk to your doctor about it, as well as your personal trainer, as well as your dietitian, because this could be a really helpful tool on your journey to optimize your health.
And speaking on that a little, what's one piece of advice or practical strategy you would recommend to men to take more seriously when managing their health and muscle mass?
We talk about, as much as body or a body mass index doesn't tell us the whole story. If you look at the research, and assuming that body mass index is an accurate measure of metabolic risk, the higher your body mass index, the higher risk for morbidity and mortality, death essentially. And it's a J curve. So when your body mass index is, let's say, around, 18 and a half to 25, which is considered quote unquote normal. Again, this doesn't tell us the whole story. You have to look at muscle mass. You have to look at fat mass. But you look at this curve, and as your body mass index increases, your risk for mortality and morbidity increases. And it's a J curve exponentially. So I think it's important for people in general, men as well as women, to understand that there are ways, not only through lifestyle, diet, exercise, as well as using these really helpful tools like body composition measurements, working with experts like personal trainers, like dietitians, like metabolic health doctors like me, and to help optimize their health and reduce morbidity and just live longer and happier, essentially.
And Dr. Saremi, final question. What does health mean to you personally as a man?
Health to me means a combination of things. It's your cardiovascular health. It's, living a healthy lifestyle, having those social interactions with friends, getting adequate sleep. It's not about just losing weight. It's about taking a holistic picture, eating healthy, staying physically active, socializing, engaging with your community. And I think that kind of sums up health overall.
Very wholesome answer. Dr. Saremi, thank you so much for your time. It's been so informational and insightful, especially for myself. And we hope to have you back on again soon.
Thank you so much. Thanks for having me. I appreciate your time.